What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
Doing good. Hey, everybody out there. This is our second part of talking about prostate cancer.
Yeah.
So I just wanted to review what we talked about last time, just real quick. We talked about, as men, it's highly likely that during our lifetimes we'll have some issue with our prostate, and that at least 1 in 6 of us, I think the statistics now show, that will get prostate cancer at some point in their life. Lots of risk factors are the same kind of risk factors that Brian and I have talked about throughout these podcasts. Obesity, diabetes, of course, family history. There's a genetic component, lack of sunlight, exposure to chemicals, pesticides. We talked about shift work, like circadian rhythm, having some issues there. Viral infections also, a lot of people don't even think about that. Lyme disease seems to have some correlation with it too. Stress is a huge contributor. Not only some of the physical stressors that we just talked about, chemical stressors, but also the psycho-emotional stressors too, and the way it sets the body up for hormonal imbalance.
A fair amount of modifiable things, but
yeah,
a lot of things to look out for.
Sleep is a big one. We discussed that. Talked about it being the third most important key to life after air and water, right?
Yeah.
So food is number 4 after that. With the prostate area and the whole pelvic floor, lots of lymph flow through there, lots of blood flow. We sit on our prostate, some of us for up to now, that with the whole COVID going on, 13 to 15 hours a day, or, we're not moving. Exercise is so important to get the blood flow and lymph flow going through there. And that seems to help quite a bit with keeping the prostate healthy.
Yeah.
One of the myths we talked about last time was this whole thing that testosterone makes prostate cancer worse. And that's not necessarily true. What they're really finding is that the conversion of testosterone to dihydrotestosterone can make the prostate swell and is correlated with prostate cancer, but also the conversion of testosterone into estrogen, or being aromatized into estrogen, is another issue also for that increases your risk of prostate cancer. So not necessarily testosterone by itself. And that's pretty huge, because that's been a myth that's been going on for a while. It's been out there, and I think with the research that we have now, that we can definitely say that testosterone, if given appropriately, may even be helpful, but it's certainly not going to increase your risk of prostate cancer. And it seems to, if you have optimal testosterone levels, it seems like, according to the research, that you may not get at the aggressive forms of prostate cancer, which is really what we want to avoid.
Absolutely.
We talked about diagnosis. So the main way to diagnose is with prostate biopsy. That comes with a whole host of risk factors. I mean, you're actually puncturing the capsule of the prostate. You can hit nerves. You're more prone to infections, bleeding, and then some of the other issues that come with just prostate cancer therapy in itself may happen from biopsy alone, right? There's a possibility. Urinary dysfunction, erectile dysfunction.
Yeah, you're definitely going in there and disturbing the peace.
Definitely disturbing the peace. So, it's becoming, hopefully the way we diagnose will be outdated real soon here, where it's not going to be used.
Yeah.
We talked a little bit about how the prostate-specific antigen, PSA, along with what's called a Gleason Score, along with tumor grading, gives you a good prognosis for how to assess and treat prostate cancer. But definitely it will give you a prognosis. So do you have an aggressive form? Do you have a more slow-growing form? We talked about a lot of men who have the slow-growing form, so probably don't need the aggressive or the invasive treatments. Real quick, a Gleason score is written in 2 parts. It's each part is 1 to 5. So you'll see a Gleason score of probably what we call 3 + 4 = 7. Your total score being 7. The 3 is the most the area of the prostate with the largest area of cancerous tissue, they grade it as a 3. 10 is being the most aggressive, 1 being the least aggressive. And then the next biggest area, they would grade as a 4. Okay, so you can see a 3 plus 4 equals 7, or a 4 plus 3 equals 7. The 4 is the first area they look at that has the largest area and how aggressive it is. The second biggest area is how aggressive it is. So to an oncologist, a Gleason score of 7 could be 2 different things, right? Like, so it could be 3 plus 4 or 4 plus 3. So
Right, taking in both factors.
Yeah, you're taking in both the 2 largest areas that are affected by the actual cancerous tissue. Conventional therapy, we talked about a radical prostatectomy, where you just remove the prostate. Comes with a whole host of issues we talked about. Radiation is part of that. Another form of treatment is systemic therapy, androgen deprivation therapy. Talk about taking the maleness away from somebody with this. I mean, you'll have all kinds of quality of life issues with that. One of the big ones is you take hormones away. Just like women going through menopause, men can have hot flashes, weakness, fatigue, all kinds of things. There is some newer therapies out there that aren't really hitting the market as fast as we'd like, or out there, in the urology clinics and stuff. But one is called HIFU, or high frequency ultrasound. The other one's called cryoablation. Both of these are beginning to be used and have much less side effects than the others. And the main thing for that last week when we talked about it was, we really have to be careful about, as men, we really need to make sure that we're well informed about the prostate cancer and what the issue is. Because most people are right away being, oh, I have prostate cancer, just remove it, get it out, without really understanding what's at stake here.
Right.
Okay. And for a lot of men, it's not so dire that it's kind of, you can wait and watch and, be more of active surveillance. And a lot of times the cancer doesn't kill you. You die long before that cancer kills you. And so I think now, like, oncologists, urologists and stuff are kind of getting the message and sitting down with men about that. But see, there are incentives there, which are kind of crazy, right? I mean, it's like, there's a financial incentive to do the surgeries in a sense. There's also the fear factor that plays a role in that. Being diagnosed with cancer, the first thing you think of, I want to get rid of it.
Yeah, absolutely. Without
really thinking about all the side effects or the radiation aftermath, what androgen deprivation therapy does. And asking about some of the other things, which we're talking about, the high frequency ultrasound, how about the cryoablation, that type of thing. So anyway, that's where I think we kind of ended last time.
Yep.
So I'm going to just, let's pick up there, because I want to just talk about some more things about conventional treatment. And then we'll go into the natural stuff.
All right, let's do it. So conventional treatment still.
Yeah. So,
all right.
So one of the things Brian, you've heard of like, Propecia, or, these drugs for like hair restoration and stuff like that. Like one's called Proscar, or I think it's also Propecia. That's the name. The other one is called Avodart. These things are 5-alpha reductase inhibitor drugs. So what they do is they inhibit testosterone from getting converted to dihydrotestosterone. Dihydrotestosterone is, if you have high levels of it, it's what brings on male pattern baldness. Okay. So it's one of the factors, you know? So you'll see a lot of that. You'll see it actually prescribed sometimes, these drugs to women. But, if we know that dihydrotestosterone increases the risk of prostate cancer and the aggressiveness of a prostate cancer diagnosis, then, this drug can help with that. So that's one of the reasons why they're prescribed. But the main reason they're prescribed also is for BPH, benign prostatic hyperplasia. So it can help with urinary symptoms in men. So you see a lot of men. I'm sure you've seen this come along through your clinic, where if you're looking at a drug list, you'll see this with a lot of middle-aged men where they're on these drugs.
Yeah. Yeah. And it makes sense after everything you mentioned.
Yep. And then the other drugs that may be used are, and this is especially true with androgen deprivation therapy, where you're just flatlining, bottoming out all the hormones. Again, cancer is associated with high levels of, estrogen, dihydrotestosterone, and et cetera. And so if you do androgen deprivation therapy, you're just trying to flatten that out. So there's other drugs that are used that are also aromatase inhibitors. So they prevent testosterone from going into estrogen. So you're keeping your testosterone longer. So Arimidex is one, Femara is another one. Some of these drugs are used in breast cancer patients too, or reproductive cancers that are estrogen sensitive.
Now, are these going to be prescribed along with like chemotherapy and radiation treatment, or is this?
They can be, but yes, they can be. But sometimes it's prescribed before you even get there. Usually, a lot of these are just to help with like urinary tract symptoms, like Proscar, Propecia, Avodart. They're just help with urinary tract symptoms for the BPH. But they can be prescribed before, or so a lot of times after treatment also. So aromatase inhibitors can, and during, so anytime.
Mm-hmm. Okay.
I've seen all. So it just depends on what the oncologist is going to do.
Yeah.
Another thing that I know we've talked about PSA. A couple things about PSA. It's gotten a bad rap because it's highly sensitive. So it can tell you that, something is going on in the prostate. And it may be indicative of prostate cancer, but it has a low specificity, meaning that you may get a lot of false positives. And another example of a test like this is mammograms. So, it's very sensitive. It can pick something up, but it just can give you a lot of false positives. So a lot of people just say it's better to look at the trends of the PSA, and it may not be the best test out there. Now, there's a lot of other prostate cancer specific biomarkers. PSA is the most common one. There's other ones out there called prostatic acid phosphatase, or PAP. That's pretty specific. There's carcinoembryonic antigen. These things are more broad spectrum tests that can be used for other cancers and things like that. I just wanted to bring them up because these may be some tests that people would see.
Yeah, they're common. Absolutely. That's like the first thing I hear about mostly is the PSA.
PSA, you're right. One that is really important is is what we call TGF beta 1. And basically that's a protein that has many cellular functions. It controls cell growth, cell proliferation, cell differentiation, and apoptosis. So some studies have shown preoperative plasma levels strongly predicts cancer progression in patients who are undergoing, removal of the prostate. So I'd say it's the next most common one besides PSA that's being used. Other things that may be out there, and we've talked about some of these, but if the cancer spreads, then you may have bone markers that you would use. These things are like alkaline phosphatase, N-teleopeptide, C-teleopeptide. You may do bone imaging scans. And then there's what we call the terrain labs, which we've talked about a lot, Brian, and that's a lot of these labs really can assess where you're heading. So we talked about fasting insulin, it's like fertilizer for cancer growth, keep your insulin levels down. Talked about hemoglobin A1C in the past. It's a marker of aging. HSCRP, a marker of inflammation. Again, if we keep sugar levels down and can keep inflammatory markers down and cytokines down, you're less likely to not only have any form of cancer, but you're also more likely to have less aggressive forms of cancer by making sure that these levels come down. And this all goes back to lifestyle stuff, right?
Right.
I mean, one of the best ways to get your hemoglobin A1C down is by not overeating, basically.
Right.
Exercise, the lifestyle stuff, get plenty of sleep.
Yeah. And there's one thing we know for a fact is that these cancer cells like sugar. So all that
Right,
kind of falls in line.
right. They like sugar. And, one of the things I try to stress to my patients out there is overeating, whether it's healthy food or whether it's, junk food. Those two are bad, are just as bad as far as I'm concerned. So you really want to make sure that you're, it's like Goldilocks point. Don't want to eat too much. Don't want to eat too little. You want to make sure that it's just right.
Right.
Try not to overeat. Of course, another thing that would be done are hormone panels, right? Because we are talking about a reproductive cancer that's very prone to hormones. So free and total testosterone, of course, DHT, estradiol, DHEAS, sulfate. That you see that as a supplement in a lot of stores. A lot of men would take that to, thinking that you're boosting testosterone levels, women and men. And then the other thing that's really important, and this is just for overall health, just looking at to train, are coagulation factors. So fibrinogen, D-dimer, these things basically with advanced forms of cancer and aggressive forms of cancer are very important to know, because a lot of times when the cancer is progressing, these things really can come into play and can wreak havoc on the body.
So higher levels are
So the
correlated
higher
with a negative outcome.
Right. So the higher levels of fibrinogen, right, you're going to be more likely to form clots, right?
Right.
The more inflammation you have in your body, the more likely you're going to form clots. Probably, the fibrinogen D-dimer tests are going to be up also. So anyway, that's pretty much a broad summary of just the conventional treatment. So let's just go into some of the natural stuff that, my specialty and what I tend to do at my clinic. So first of all, it's about education, which, that's one of the reasons why we're doing this podcast, because we want to make sure that people make a well-informed choice with whatever their treatment is.
Yeah.
But one of the main herbs out there, let's just get right into it, is called saw palmetto. And why does this one have such good use or so well known? Well, it inhibits DHT. So if you inhibit DHT like you did with the drugs, the Proscar and Avodart, you're going to decrease swelling of the prostate. You're going to decrease risk of cancer. It also seems to have anti-cancer properties, induction of apoptosis, modulates growth factors in the body, suppresses COX-2. COX-2 is an inflammatory marker. High COX-2. There's drugs that inhibit COX-2. So you heard drugs called COX-2 inhibitors.
Mm-hmm.
Anyway, suppresses COX-2, makes cancer more resistant to high COX-2 makes cancer more resistant to treatment. So you want to lower it.
Okay. Is there anyone specifically who should be watching out for not taking these supplements, or these herbs specifically?
With anything, you just want to make sure that you're taking them for good reason.
Right. Okay.
Right. And with a supplement like saw palmetto, it does affect hormones. So I don't like just saying, okay, all men take it and don't worry about it, and we'll see you in 5 years, there's this notion out there, well, you take saw palmetto, you're going to prevent BPH and prostate cancer. That's not true. I mean, it doesn't work like that.
Right.
But it does have some anti-cancer effects, and long-term treatment does. One of the main things men have is, we talk about urinary flow. As we get older, men tend to have a weaker stream. The whole thought is the prostate kind of squeezes on the urinary tract and causes that weak flow. Well, the saw palmetto seems to make that less, especially with long-term use. The nice thing about it is long-term use, you know, it's a lot less, there's a lot less side effects with it than taking other drugs.
Okay.
You know,
Yeah.
for it. So that's one reason why I like it. And there's very little risk of having really bad negative side effects. But again, if you can take the medicine as needed and no longer, that's going to be the best way to do it.
Right.
So it improves quality of life with BPH as the prostate swells. This is interesting. I wasn't really aware of this, but it does seem to have a positive effect on sexual function. I mean, I guess that makes sense if it improves prostate function in itself, but improving sexual function, that's cool. Because it's
cool.
Yeah, it is, because the thing is how many men are going to the urologist over just symptoms like that?
Mm-hmm.
You know? So I rarely use it as a standalone herb. When I recommend it, I usually do a combination, and one of the herbs in that herbal formula is nettles. And nettles is another thing that has some research on, you know, it helps with BPH, decreases the volume, increases quality of life issues with BPH, does seem to help normalize sex hormone binding globulin, which then helps modulate hormonal levels. It's a very, very safe herb to take. So those are my two main herbs that I recommend, that if we were saying anything that I would call them prostate herbs.
Okay.
They affect the prostate. The other herbs that I recommend is, let's say we want to normalize hormones. There's a number of them that could, and we talked about some of this in our testosterone talk. There's herbs out there like epimedium, horny goatweed. So that name kind of lets you know
Speaks
what
for
it's
itself.
about. Yeah, it speaks for itself. Seems to have an effect on modulating hormones, boosting testosterone. These are anabolics, what we call anabolic herbs. One of my favorite that has the most research out there is an herb called Panax ginseng. So some people have heard about ginseng anyway. It enhances, helps modulate hormones. It enhances the hypothalamic pituitary adrenal axis. It's a stress response modifier. This is one of the herbs that people can be on long term. It's one of the adaptogenic herbs I do to help with stress, any form of stress. Also an anabolic. It boosts your immune system. It reduces cardiovascular risk, anti-proliferative activity against prostate cancer. There's actually some studies on that in some animal studies. So it's pretty cool. Safe herb, has a good record of use. One of those things that I'll recommend in conjunction with both BPH and prostate cancer and prevention and treatment. And then just there's general therapeutic herbs that I recommend pretty much across the board for cancer. And can you guess which one it is, Brian? What herb I love the best? Curcumin from turmeric. One of the, how many times have we talked about it? I mean, there's so much research on it for its immune modulation, its anti-neoplastic activity. It's my favorite anti-inflammatory. I think it should be a go-to. I think all PTs ought to be recommending it to their patients because it's very safe. It's just, you're not going to go wrong with it. As far as prostate cancer goes, there's a animal study, where it's seemed to be potentiated by taking in conjunction with a compound in cabbage sprouts. So eating your cruciferous vegetables, which we'll talk about in a little bit. But we talked about saw palmetto inhibiting DHT. Well, these cruciferous vegetables help inhibit testosterone, right, from aromatizing into estrogen. Cabbage sprouts, that may be the way it's being affected there. Another really wonderful herb that we've talked about, very, very safe, is milk thistle. And that is an herb that you could be on long term. Suppresses inflammation, inhibits IGF-1 signaling. This is a growth hormone, and any growth hormone can make cancer grow faster, quicker. It inhibits telomerase. This is an enzyme that with cancer cells, what they do is they want to make sure that there's plenty of telomerase on there to increase the life of the cancer cell. So if you inhibit that, you're also going to be fighting the cancer, decrease that. Well, milk thistle does that. It reduces lipid levels. It also inhibits what we call osteoclastic activity, which is really important. So you can even think about this possibly as a treatment for, I don't know, like osteoporosis and stuff.
Mm-hmm.
And this may be important with prostate cancer and stage, because usually prostate cancer will affect the bones. Mm-hmm. One thing about this herb specific to prostate cancer is that it slowed down the doubling time of the PSA. All right, as the cancer spreads and grows, the PSA just shoots through the roof. Well, milk thistle, if you take this, has significantly slowed down that. So that's pretty neat.
Yeah, absolutely.
Especially with a safe herb. And the oncologist is not going to, they're not even going to know what this does or what it's about. And it's a very safe herb, and it can be done in conjunction with treatment. Another herb that's really wonderful, and it's another aromatase inhibitor, is green tea. Mm. And then specifics, as far as like just general specifics for anti-cancer activity, immune modulation, is medicinal mushrooms. There's all kinds of research on that. I was just on a hike just the other day, walking around Ronaldo Village here, and saw mushrooms on a tree. And anyways, Coriolis is turkey tail mushroom, which has significant anti-cancer activity, and is really, of all the mushrooms, probably has some of the most the greatest research on anti-cancer activity. So it's just growing in the backyard.
And can you repeat the name of the mushroom again?
It's the combination. Did I lose you, Brian?
Yeah, hold on. We're still recording.
Okay.
So hello, everyone. I don't know what happened.
So anyway, if you look up that mushroom, Coriolis or turkey tail, you can look at it. It kind of looks like a turkey tail.
Okay.
Yeah. All right. So
those are all the herbs, Keoni? If that's all the herbs, I got to ask you a question.
Sure. Yeah.
I know we talk about it pretty often, but how does someone make sure they get good quality, safe herbs? What do they look for? Where do they go? That's where.
Yeah. No, it's a great question. I recommend people go through a medically trained naturopathic physician, or a trained herbalist, or somebody who's trained in functional medicine. But really, it would be a trained herbalist, certified herbalist by the American Herbalist Guild. I recommend that, or a medically trained naturopathic physician. And that's going to be your best bet to get high quality therapeutic, medicinals. For the most part, buying stuff over the counter, like if you go down to GNC or buy it at Walmart or Costco or whatever, a lot of that stuff, you're just you're not quite sure what you're getting, and you're not quite sure how it's been standardized. None of that stuff should be dangerous, because that's one thing in the US. Our FDA is pretty good about making sure that stuff is safe. But I can tell you that a lot of the herbal companies that practitioners like myself use, they're individually batch tested. There's quality control that goes into it every step of the way.
Okay.
So
yeah, I know that individually batch tested is pretty important too.
Yeah,
I know they find various compounds and mix things if they're mixed in similar, I guess, tubs or whatever it is.
Right. And this is especially true if you're getting, using herbals, which I do, that are coming out of China. So you just want to make sure that you're just getting good, high quality stuff.
Okay. So find an herbalist or a naturopath.
And people have questions, can certainly just ask us, or, connect with us as Wellman's Podcast. And I can definitely be more specific about what I use for that. Let's talk about some key nutrients, because they're important. What is the one prostate mineral that people should be on that affects male health, helps modulate testosterone? That is zinc. My second favorite mineral besides magnesium. Anyway, it's one of the best prostate nutrients. It's used for over 300 enzyme. It's essential cofactor for 300 enzymes. It's helps in the production of seminal fluid. It down-regulates growth factors. It blocks dietary copper, which kind of seems to, especially when cancer is about it, copper is needed to help cancer grow by creating new blood vessels and things like that. It inhibits NF-kappa B, which if that's not inhibited or controlled or modulated, cancer can be accelerated and be more aggressive. So that's a big one. The other big one is vitamin D. We talked about how getting sunlight seems to reduce your risk of getting cancer, getting your vitamin D levels up. Vitamin D 25 hydroxy test is the most common used test to assess your vitamin D level status. You know, a lot of people get tested for vitamin D. We've discussed this, that, you know, the range is probably, if you're on the lower end of the range, that's not optimal. You want to be kind of on the upper end of the range. So that's between like 50 and 80 on a vitamin D test. This is very interesting. Also, a nutrient that comes in conjunction with vitamin D. I think if you're going to give vitamin D, you should always take it with vitamin K. This comes out of a study by providing vitamin K in the right form and quantity, along with other supporting nutrients, phytochemicals, it is likely that excellent prostate health can be extended much longer, and perhaps poor prostate health can be reversed. A protective role of vitamin K with respect to advanced prostate cancer has been found in a few big studies. One is the Heidelberg cohort of what's called the EPIC study. It's basically essential for prostate health, which you don't really hear about.
Yeah, absolutely.
If you're going to take vitamin D, you should always take it with vitamin K. Where do we find vitamin K mostly? We find it in plants, green leafies. And if you have good gut bacteria, the gut bacteria can take a certain form of vitamin K and convert it into another form of vitamin K that's even better for you. So having good gut health is another thing. But vitamin K is huge. Another nutrient that's an aromatase inhibitor is quercetin. Quercetin is very found in high levels in onions. I mean, people should be eating onions. They should be eating cooked onions, whatever they can get them in. I try to get some onions in at least 2 to 3 every day if I could. They are so good for you, and what they do, the phytochemicals in there are just great, and great for the prostate. And it helps. It's an aromatase inhibitor. So really, us men, you want to keep more tea around, then eat your onions.
That's interesting. I haven't heard that compound before.
Yeah, quercetin. It's, I use it a lot. Quercetin also seems to, has an effect on histamine. So I use it a lot for allergies too. So there's some neat research on that. You've heard of resveratrol, right?
Yep.
All right. So
drink up.
Yeah.
That's what I heard, Keoni.
Yeah. Drink that wine. Yeah. Resveratrol has a number of potent activities, anti-cancer activities. High levels in food would be, what is it found in? Like, grape skins, grape seeds, peanut skins, chocolate, cocoa. As far as specific study with prostate cancer, it seems to reverse in a study with using Taxol, a chemo drug. It seemed to reverse drug resistance of the cancer to Taxol if you took resveratrol. So that's pretty neat. So Taxol in conjunction with resveratrol makes the chemo more effective.
Wow.
Yeah. Another compound that is very important that I just love is lycopene. Lycopene comes from tomatoes, tomato products. And we talked about this long ago in our tomato podcast cooked tomato products are better. You get more lycopene in the cooked tomato products. So always have a can or jar of tomato paste close by. Put it in your pocket, close to your prostate.
Close to your prostate. Yeah. Sit on it.
Eat it like, spread it on bread, put it on pizza, whatever. But anyway, it's really good. So tomato sauce, that type of thing.
That's awesome. And how many
Yeah.
podcasts do you know that have a tomato episode? Screw you, Joe Rogan. We're
That's
set.
right. Yeah, I mean, people really need to start listening to us more. We give some incredible information out here. We're taking care of people's prostates in very easy ways,
Yeah.
non-invasive ways. There's a product out there that I use. It has the saw palmetto. It has the nettles in there. One compound it has in there is something called chrysin. Again, this is a plant compound. It's a potent natural aromatase inhibitor. Okay, so again, keeping that testosterone around can help. So a lot of times you'll see that in like combination products. So other foods that we may have not talked about, we talked about cooked tomato products, pumpkin seeds, cruciferous vegetables, pomegranates, nuts and seeds. I mean, have all kinds of minerals, zinc, selenium in there. Very, very good for you and important to use. Vitamin E is another one that I'll use. That's found in a lot in nuts. What else?
So you should be eating a trail mix for your
right
prostate health. That's for sure.
Right. Oh, there's another compound out there, plant compound. It's also found in saw palmetto. It's called beta cytosterol. It's just a plant sterol that it's effective with BPH. You'll see this in by itself, but it's also in a number of plant whole herbs. Other prostate cancer inhibiting foods. We said pomegranate, citrus peel is one, avocado, spinach. Maybe that has something to do with the vitamin K. Foods that are rich in carotenoids. We said tomatoes, but egg yolks are. Salmon is the astaxanthin in salmon. You see that as a supplement. Paprika, saffron, those are high in carotenoids. There's a compound in strawberries called fisetin that also has some prostate cancer inhibiting effects. In the cruciferous vegetables, it's the glycinolates, the isothiocyanates. These are the compounds that also can have prostate cancer inhibiting effects. Flaxseed, chia seed. There's actually, we talked about nuts, filberts specifically, almonds and sesame seeds all have specific compounds that can help. Brazil nuts are high in selenium. So, we're just getting back to the basics, whole foods, really.
Yeah, it seems like you need to eat a varied diet.
Yeah, and we're talking about pretty much like the Mediterranean diet here too, right?
That's what I was thinking of. Yeah.
The other thing I'll have my cancer patients do is, assess their urine pH with urine strips, and if your urine is acidic, lower than 7 on a pH scale, then we're going to supplement things to basically make the urine more alkaline. So sometimes it's good to make the urine very alkaline for a short period of time. The urinary pH that you're trying to get is between 7 and 7.5, and you can get these urine pH strips at any drugstore.
So an acidic environment is a little bit more
acidic
productive for cancer.
Yes, exactly. So anyway, I think that's pretty much what I wanted to go through there. Did we miss anything, Brian? Is there anything else that we should talk about as far as that goes?
Broke down the prostate herbs, saw palmetto, and nettles, which there's a international nettles eating competition, Keoni. I don't know if you knew that. So that guy's got to have really good prostate health.
Oh, yes. and well, speaking of nettles specifically, you certainly can eat the leaves and stuff like that. You have to cook them if you...
Yeah, he was eating them raw, and it seems like it's a painful experience.
It's a pain, yes. Stinging nettles, they will sting you. Yeah, absolutely. Go roll around in a nettle patch, and you'll be, your skin will be highly irritated, and you'll be in pain. But if you cook the nettle leaves, you get rid of all those stingers, and that's what you're eating. But with the nettles herbal, specific for prostate, you really want to focus on the root, and that's where the beneficial compounds are on the root.
Okay. And you would cook the root and eat the root. It's not.
Well, you certainly can, but what you do is you would just process the root so that you can get a high enough dose and put it in capsule form to get a high enough dose.
Gotcha.
And I think with the dose of both saw palmetto and nettles, we're talking about, I don't know, somewhere between 500 to 1,500 milligrams a day.
These are things, those two herbs, Keoni, you kind of recommend for males on occasion, but you definitely recommend them for prostate cancer patients.
I recommend any man that has prostate issues. I'll recommend them. BPH, urinary type symptoms. I will recommend them in an intermittent way where people may be worried about or whatever. I will have them be on them for a while. Then we may take a vacation of it for a while. And then we'll go back on it for a while. I'm just not, with herbs, I'm kind of weary of just people being on them long term and, end of story. I'll just be on it and then I'm kind of protected. I mean, you really do need to have a physician that will kind of test and see if it's really helping. Ask the question, I mean, did your urinary symptoms improve? They should have improved within a month or so of being on that, within a couple of weeks of being on it. If not, is it balancing hormones? If it's not doing that, then should we really be on it? Same goes for the drugs, to ask yourself the question, are these medications doing what they need to do? And what are the side effects that you're dealing with? Weigh the benefits, the advantages and the disadvantages, and then make your choice, you and your physician and healthcare team, whether you should be on them or not.
Yeah. Okay.
There is one thing that I do think that, where is it? That I think I didn't really go into as much as I'd like. And that is talking about the specific drugs, Avidart and Proscar.
Mm-hmm.
And
yeah, we were talking about them in the beginning.
Right. And I had this when I was doing some of the research for just doing this podcast. Let me see if I can just find it where it is. I don't want to say it wrong here, but one medicine, I think it's Avidart, is much better to take than the other one.
As far as side effects go, or
as far as side effects and as far as the beneficial effects of what it will do for you.
Right.
Let's just see here. Hang tight if I can find it. Yeah. So basically, Avidart over Proscar, right? Avidart has a longer half-life of 3 weeks versus a short half-life of several hours of Proscar. So that helps. So you're not constantly popping the pill, right? So that's one benefit. The Avidart affects 2 types of isoenzymes where Proscar only affects 1 type. So you're getting like this dual inhibition. It's just a better med than the Proscar. So that's really what I wanted to say about that. Another thing is we talked about the Mediterranean diet. There is some research that seems to suggest that red meat may affect prostate cancer. We have to be real careful with that because we've heard the old cliche, correlation does not imply causation. However, there's something there. And again, we just gave a whole talk on plant medicines, plant foods, green leafies, having some prostate benefits, whereas red meat, you certainly can't say the same. So, a plant-based diet.
We're seeing red meat. Okay, red meat.
Yeah, so you just want to make sure, the research definitely seems to support like lower meat consumption seems to have more of a beneficial effect on prostate cancer.
It's interesting with the kind of upswing of the carnivore diet being a popular fad right now. I don't know if you've heard of that, Keoni.
Yeah, well, it depends. What are we using the diet for, right?
Right, absolutely.
So are we using it for prostate cancer? I would hope not.
Yeah.
I mean, are we using it to drop weight and to balance blood sugar? That I can see that,
Mm-hmm.
But
yeah, it's always patient specific.
Yeah, but I'm still, the more research I see, it's just like it's pretty much like foundational in the research. Like there's not much discrepancy and not much argument against, eating a plant-based diet. I mean, it's pretty much healthy for you across the board, healthy for most, I mean, I can't think of a cancer where it's not healthy for you.
Yeah, I think in 140 episodes, eating a varied, healthy diet has come up each one.
Right,
So
right.
just, yeah.
Yeah. Other things that I may not mention specifically, but I mentioned cruciferous vegetables. There are compounds in there called diindolylmethane, glycosalinolates, isothiocyanates. Those things are found in those, but you can also take them in supplement form to help. We didn't really talk about a supplement. We mentioned it a little bit, DHEA. I do think, like with prostate cancer and prostate treatment, you want to be a little bit cautious with that one because it may push the pathways towards DHT. You just need to test, and same goes for testosterone. So in review, I mean, we want to use a multifaceted approach. Unfortunately, most people don't get that. They just get the conventional approach. Careful monitoring of the prostate cancer may be your best option. Like, wait and watch and see what happens. Maybe just treat, the symptoms as they come up, especially if it's not an aggressive form of it. Lots of decision making. Be well informed of how you go about doing that. Get in touch with people like me and you, Brian, and are there other options out there? Can we point people in other directions to better educate themselves with more natural therapeutics that can be, if done right, and if they're in with a practitioner that knows, can be done in a way that's not going to inhibit their conventional treatment routes. Mm-hmm. So, and I deal with that a lot with my cancer patients. And then ask about some of the new treatments out there. Sometimes those treatments may be a lot better options. So high frequency ultrasound, the cryoablation, these things have very low side effects compared to the other ones.
Yeah.
And not to mention, you can always go back in if you miss an area to retreat with those treatments, especially the high frequency ultrasound. So really what we want to do, right, what's life all about as far as I'm concerned, and medicine should really focus on this, is like, how can we improve your quality of life? How can we help you improve your quality of life with these so-called dire diagnoses, which we're starting to find out may not be so dire, especially in regards to prostate cancer. So it's, when we hear cancer and get diagnosed with it, it's not necessarily a death sentence.
Yeah.
So anyway, I hope that helps people out there. Ask us any questions that you have. Talk to us on Facebook, on social media. Get in touch with us.
Yeah, absolutely.
Let us know what you want to hear from us also, or what guests we should get on.
We will talk with you next week.
Take care.